There are two main culprits: sugar and fat. These combine to create too much fat in your bloodstream, which in turn sets the stage for the buildup of arterial plaque, a condition known as atherosclerosis or heart disease. It should be no surprise that we have 800,000 people in the U.S. who have a first heart attack every year, and another 500,000 who have a second or third one. The typical American diet is absolutely loaded with sugar and fat, and what's more, modern processed foods have additives that make the sugar and fat worse by promoting inflammation, and that, along with these additional factors, fuels heart disease like gasoline on a fire. Stress, high blood pressure, smoking, lack of exercise, hormonal imbalances, overproduction of insulin, increase inflammation. The good news is that once you know how heart disease gets started and what fuels it, you can easily stop and reverse it. Imagine living a life free of heart disease. Not only will you feel great and have much more energy to do all the things you want, but you'll have peace of mind too. And if you stick with me to the end to receive your heart disease prevention and reversal kit, I'll make sure you have all the best options to get healthy and stay healthy. Now, just ahead, we'll talk about the 4 things that happen right before a heart attack. But let's first look at cholesterol and the myths and propaganda surrounding it. You probably already know your cholesterol is made up of 2 types, the good HDL and the bad LDL. But that's just the half of it, because the bad LDL cholesterol is especially bad if it's the small, dense type or pattern B. Some doctors just give you a total cholesterol number, such as 190, and you might think that's a good number, but not necessarily. You need to know how much of your cholesterol is the good HDL type and how much is the bad LDL type, and then you need to know whether your LDL is type A or type B. Your doctor can tell you how much good and bad cholesterol you have, and these 2 numbers provide the total, but the number is meaningless unless you know these details. You see, if you have a high level of good HDL cholesterol, you can get away with a higher level of bad LDL cholesterol, unless your bad LDL cholesterol is the dangerous pattern B type. Do you know if you have pattern A or pattern B LDL? Fortunately, there's a test that will tell you, but it's rarely given unless you ask for it. Another important test is the new Plaque test, which measures the amount of plaque that's already built up in your arteries. It's remarkably accurate in predicting your potential for deadly heart attack or stroke. Certainly every person over age 50 should have these tests, but again, you'll have to ask your doctor for them. And now you can. In my book, Fix It, Dr. Crandall's 90-day program to stop and cure heart disease, I've included a chapter titled Must-Have Heart Tests for Everyone Over Age 50. The good news is that these tests are readily available, and they'll give you the knowledge needed to take immediate corrective action. But I can tell you that, in my own practice, I have found that most people, even those as young as age 35, have already developed some heart disease because we have way too much fat, sugar, and processed foods in our diets. And even if you don't have a sweet tooth, you should know that simple carbohydrates such as pasta, chips, white bread, potatoes, and rice, as well as most processed foods that come in a bag or box, all convert to sugar in your body. That's how heart disease gets started without you even knowing it. Remember that my book, along with your 2 free reports, These 4 Things Happen Right Before a Heart Attack and Losing Weight Over 50, are yours free when you try my advisory letter, the Heart Health Report, for just a few pennies a day. Getting this kit is smart, not only for the life-saving information it contains, but also because you'll stay abreast of the latest advances in the Heart Health Report, which I bring to you from the front lines of heart research in my daily cardiology practice. Let me show you what you'll discover in my new book. You'll see how to boost your good HDL, which will then make your bad LDL less harmful, and that's especially important if you have a dangerous pattern B type. You'll also learn that cholesterol is not a dirty word, as the pharmaceutical industry and many doctors would have you believe. The fact is, your body makes cholesterol, and it serves many important metabolic functions. For example, cholesterol is an important structural component of every cell in your body. Cholesterol plays a key role in making your hormones. Cholesterol is essential to the digestion of your food. Cholesterol plays a role in fighting infection. Cholesterol helps make vitamin D, which not only protects you against disease, but makes your teeth and bones stronger. Sadly, we've been trained to believe that cholesterol is bad and that nearly all of us need to take cholesterol-lowering drugs. Not true. And these drugs can have harmful long-term side effects. Why take them when there's a better solution that you'll discover in the free kit you'll receive when you get the Heart Health Report for a few pennies a day? You see, cholesterol only becomes a problem when you have too much LDL relative to your HDL, and it's only a very serious problem if your LDL is the dangerous pattern B type. That's why you need a full cholesterol test and the Plaque test. This dangerous combination of too much LDL with a high concentration of pattern B LDL typically occurs when you have a diet high in sugar, fat, and processed foods. And it's made worse if you smoke, don't get enough exercise, are under stress, or have too much inflammation in your body, even if that inflammation is from an infection or common arthritis. Sadly, most doctors don't have the time to explain these things, nor do they always know about the latest advances in heart health or even the best tests to give. But these are the kinds of things I discuss every month in the Heart Health Report. Okay, let me show you what heart disease is and how it gets started, and I'll bet you've never heard it explained this way. Your arteries are composed of millions of cells aligned in what cardiologists call tight junctions. But stress, inflammation, hormonal imbalances, and high blood pressure can stretch the artery and damage it in places, allowing the small, dense, and dangerous pattern B LDL particles to embed in these tight junctions. This is the beginning of heart disease because it triggers an inflammatory immune response. It's like getting a splinter in your finger in which the surrounding area swells and turns a little red. That's your normal immune response isolating the splinter in order to expel it, which it typically does in a few days. Some people's bodies do this well, but others can't leave a splinter under their skin because it will become further inflamed and infected. Now a similar process occurs with the embedded pattern B LDL particles in your arteries. Your immune system goes to work to repair the damage, but the normal inflammation process creates something akin to a blister. Some people heal these blisters just fine, but others, and this explains why some people are more prone to heart disease than others, don't make the repairs very easily. And of course, you can't dig the LDL particles out of your arteries as you would dig splinters out of your skin. So the embedded fat particles trigger inflammation, which creates a blister, which attracts more fat particles, and this starts the plaque buildup. Next, your body tries to heal this condition by sealing the plaque with red blood cells, making something like a scab. But this sealing process not only narrows your arteries, cutting off the full flow of blood, it also can cause hardened blood clots to form. And it's the rupture of these clots that cause heart attacks and strokes. Consider this. If you have triglycerides over 150, pattern B LDL cholesterol, and low HDL, you'll build plaque faster, which over time calcifies and hardens. And if a piece of this calcified plaque breaks off and travels to your heart or brain, it can kill you or leave you debilitated for life. But that doesn't have to happen, ever. And that's why I want you to have my heart disease prevention and reversal kit as my gift to you when you start reading the Heart Health Report each month for just a few pennies a day. But before we get to that, I want you to understand the connection between heart disease and inflammation, and also learn about the 4 things that happen right before a heart attack. Today, medical researchers are realizing more and more that numerous diseases are caused or influenced by chronic inflammation, including heart disease. And when you start reading the Heart Health Report, you'll see all the different ways you can reduce inflammation so you can avoid not just heart disease, but many other diseases and health problems as well. Already you know how heart disease gets started and then progresses. So here are just a few things you can do right now to prevent, reverse, and cure heart disease. First, if you smoke, you need to quit and get medical help if this is difficult for you. Next, get regular exercise, as this will raise your good HDL cholesterol, which makes your LDL cholesterol less of a problem. Also, make sure you have a release for stress. You can use physical outlets such as tennis, golf, or fishing, or more spiritual and religious means such as prayer, meditation, and even more fun social activities with friends and family. Next, I strongly advise that you cut out all sugars. Also, cut way back